So within this segment or session, everyone, I will discuss the different boundaries that exist within the context of your profession. Your profession as a health and social care practitioner is guided by these principles, these professional codes, these codes of conduct. So again, health and social care professionals, including yourselves, are expected to uphold key boundaries that you should not cross. Okay, and the reason that you shouldn't cross these boundaries is to protect yourselves, the service users, and the organization's reputation. The relationship between health and social care professionals and the service users should always remain professional at all times, everyone, even when you are working on a very personal and difficult issue. So why, you should ask yourself that why you shouldn't cross that professional boundary between you and the service user, or between you and the family members as well. Well, it all boils down to trust. So a trusting relationship is basic to effective care practice and nursing practice. Because as you know, if the service users lose trust in you, that duty of care is not really duty of care. So service users, because remember, even if they go into a hospital for a minor operation or a major operation, or if they even go into a hospital just for a visit, by the way, to a visit to the GP, not GP, but to the doctor, to the consultant, they are at their most vulnerable. And remember, when you are at your most vulnerable, you need to feel safe. And so service users within health and social care needs to feel safe in your care and believe at all time that you will act in their best interest. Your role, as a healthcare practitioner, is to act with integrity always, maintaining these clear professional boundaries. And so what this means, everyone, is that acting professionally means keeping relationship clear. You are the professional, they are the patient. You are the professional, they are the service user. So you need to keep that relationship very, very clear. So responsibilities are on you, the care professionals, to maintain that balance of emotional closeness and also that professional distance. I'm not saying it is not okay to be invested in the service user emotionally, but there is a point where you cannot get too close because that's going to blur the relationship between professionalism and something else. Okay, everybody understanding so far?
Yes. Yes.
Okay, good.
Yes.
Okay, and so you may ask yourself now, what are these boundaries? So the boundaries exist. So in terms of what are they? Client focus. Client focus meaning the service user. So the needs of the service user at the center of any decisions made about them. So that boundary should be focused just on the client. In terms of another boundary that you also, in terms of communication, by the way, confidentiality, you should never ever discharge personal information about yourself to the service user. So self-discharge meaning no disclosure of information of yourself and your personal life to the service users. Sometimes you may often observe in wards or in care homes as well, that the service user knows so much about your own life than other people in your family. And so why is that? That is because you are sharing too much. And once you share too much personal information with the service user, it is blurring that professional boundary, everyone. So let me ask you guys a question. Let me just go to the screen. Do you guys have personal discussions with your clients about what's going on with you?
No, never.
Um, my clients only know about my children because they call me at work. And when they call me at work and they will go, oh, is that your daughter? What's her name? Is that your son? What's her name? You know, and I tell them, oh, it's so and so. And next time they see me, they say, oh, how's Victor? How's Jonathan? That's all. I don't know if that's right or wrong.
Well, you know, I suppose in some ways that's, you know, you may argue that, you know, it's up to you, because you can say to them, I'd rather not talk about my personal life. That's fine. Yeah. Yeah. So, I mean, if they say, who's that your son? You just say, you know, I'm sorry, I'd rather not speak about my personal life, because then, you know, they're it's just that area where they're getting a bit too familiar with you, that might have an impact on their care. Do you see what I mean?
Yeah, yeah, yeah.
Anyone else wants to share? Are they telling about their, you know, what they ate for dinner? Because oftentimes I will observe that, you know, the care workers or even the nurse, you know, they're telling the service user what they had for dinner. You know, their dress size, their pants size, you know, all of this stuff that you shouldn't be sharing these information with the patient.
Sorry, Mr. Morris.
Yes, go on.
Yeah, what about, you know, so as Helen said, sometimes they will be asking you if like if you have children, some question like that. It's just
Yeah, I
asking.
mean, you know, you can answer the question, yes is yes, but then if you are going to go beyond yes, if you're going to say, I have 10 children, you know, and you have 5 boys, 5 girls, that's a bit, you know, I think that's oversharing a bit much.
One of them, where this is a long time ago. I don't work with that company anymore. She knows the date of birth of my children, and every year she writes me a card. Give it to Victor, give it to Jonathan, give it to Michelle for me, and she writes a card out.
Okay, do you see exactly what you just said? Because it could be misconstrued, Helen, when a service user now gives you a card not for you but for your children. That could be misconstrued another way. Do you see what I mean?
When I was leaving that company, she was crying. She cried to the management that Helen is going. So she started crying to everybody that I'm leaving. And the management called me and said, why are you? I didn't tell her I'm leaving, but she probably heard from somebody else. That why did I tell her I'm leaving? And I said, I didn't tell her. She just find out from another staff, I guess. And when I did leave, eventually, her mom just called me one day because she's got my phone number. Her mom called me one day. This is like over a year that I've left. Her mom called me and said, Helen, I just want to tell you that Amanda is ill and she's in the hospital. I'm like, I don't work for that company anymore. Why are you calling me? She said, well, she realized she's found of me. She just want to let me know. And she found my number in her phone number. And she just want to let me know that she's ill and in the hospital. If I want to speak to her, if I want to come and see her. And I said, okay, but I never responded. But I think it's that relationship that we had, me and her, that her mom get to know about. That's why she had to inform me after almost over a year that I've left the company. She still called me, you know, to say that I just want to let you know.
And that's, I mean, there's nothing wrong with that, with where family members, you know, because of the care that you've provided for their loved ones, that they you know, they will want to inform you should anything happen, or in this instance that the mother was in the hospital. Question then, something you just said. So how did she get was it your personal number she had?
Yeah. What's my personal number? She had my personal number.
So how did she get the personal number? Was this domiciliary care or?
It's a community care where
okay. So,
yeah.
right. Okay.
She has my number because sometimes when I call her, a number, she stored my number then. Because I have to call her sometimes. She goes to day center and I have to go and pick her up from the day center. I drop her there and I pick her up.
Sure. Right.
So,
yeah, that's the other thing is, you know, sharing of your personal number with clients sometimes, huh? You know, it's another area where you know, maybe if they had a company phone or something like that, they should give it to you. I don't know, huh? All right, so moving on, everyone. So dual relationship. So you should not hold more than one relationship with the service user. I'm sure everybody knows what this means. Yes?
No. Dual relationship, what does that mean?
Can somebody explain what this means to Helen?
I think it means that you have that professional relationship with them, and that's all that you should maintain. There shouldn't be any other relationship where you would have to call them outside the relationship of you being their carer and support worker, and they're a service user. So it should remain that is the only relationship you should have with them. I believe that's what that means.
Exactly, right. Yeah, so Helen, dual relationship, meaning that as Patience so eloquently said here, is that you really should not have that, you should only have that professional relationship with the service user. You're the support worker, and that's it. Okay. I'm sorry to even say, but you shouldn't even be. You know, sometimes I've observed where the family member is introducing the care worker as, oh, come meet my friend who's taking care of my mother. You know. No, you are a professional, and so you are the care worker. You know, and you have a job responsibility to do. Other boundaries, by the way, and you probably know this, you should not work outside of your expert level. So you should work within your competence, meaning understanding what your limitations are of your role, your personal and professional skills, your capabilities, and then if you if, for example, you encounter something that you can't do, know who you should seek support from. So you should seek support and advice from other professionals for yourself and your service users. If, for example, you encounter something that you don't know how to do. Other boundaries, everyone, and this is very important, especially with COVID-19 as well, in terms of holistic health, look after yourself. It means look after yourself mentally, know how to manage stress and your emotions within work, and know that if work is causing you stress, where to go to for help. So looking after yourself, fit for a job you're required to do physically and mentally, psychologically, managing stress and emotions within work and caused by your work. So oftentimes, you know, we had this discussion with healthcare workers, is that because of the lack of staff sometimes, you know, they are doing so much, and as a result of that, that has an impact on them mentally. But they are aware that, you know, the job is having an impact on them, so they are aware that they should where to go. So they often go to counselors, you know, or even discuss it with the line manager as well. That, you know, this job, you know, the work is too much. Oftentimes within big organization, especially the NHS, they have occupational health where you can go to for help. Okay. All right. So what happens when you cross that line, that thin line, that boundary? What happens when you cross the boundary? So again, boundaries are defined as the helping pathway for both service users and healthcare professionals and are very vital to ensuring that the service user's needs are met. So it's very integral to you being effective as a healthcare practitioner. So professional boundaries can either be crossed or broken / violated. So the difference between crossing boundary or broken boundaries, a boundary crossing is seen as an aberrant or a deviation from therapeutic activity that is harmless, non-exploitive, and possibly supportive for service users and professionals. Okay. When you violate that boundary, and just think about safeguarding issues, this is now where we're talking about potential for abuse, by the way, neglect, physical abuse, stealing from the patient, these are kinds of things. So a boundary violation is harmful or potential to harmful to service users and professionals because it constitutes exploitation of the service users. Any questions? I think these are quite straightforward in terms of what they say here. All right. So before I give you the class activity, so we're going to now look at crossing or breaking the boundary. So boundaries are crossed, and then we will do the class activity at the end. Boundaries are crossed in health and social care really at various points and for a variety of reasons. Sometimes you consciously don't know that you are really crossing or breaking the boundary. It could be simple human errors. So when you're tired, that might exacerbate your judgment or lessen your judgment sometimes. So tiredness, stress, manipulation by that service user. I've observed many times where, that service user will manipulate you with sweet talk, with many, many things, just to get what they want. And as a result of that, you sometimes break that boundary. Should you hug a service user? Anybody can answer that? Should you ever hug a service user?
I think it's personal, isn't it? It's your personal space, if you want them to cross that line or not. Most service users always, that's the first thing they do when you get to them. They just want to hold you and hug you. And if you are depriving them of that, they don't like it. It makes them feel sad and not comfortable with you.
Sure.
So you need to find a diplomatic way of doing it.
Good answer. Yeah, I mean, in terms of physical contact, in terms of hugging, yes, you might be depriving them of that, but at the same time, you don't want it to be misconstrued, by somebody else, looking in, interpreting really what that hug means. If that hug is all a hug, that's fine. But if that hug now deviates to something else, then certainly that that will raise questions. Okay.
Yeah.
Sorry, Mr. Morris.
Yes, go on.
Okay, I mean, according to the company policy, I think we have to follow the company policy. But sometimes when you go into the flat, you didn't even expect it. The customer will just come and hug you when you don't expect it.
Well, for sure. So in that instance, Martina. So in that instance, so it's the service user who's hugging you, not you going, whenever you go into the home hugging them. So again, there are many ways to do that. So if the service user hugs you, all you have to do is just stand still and let them hug you. Yeah. Yeah.
Yeah.
But then if you now, also return that hug and it persists for a while, then that something is wrong with that. I mean, there's nothing with somebody coming to hug you, yeah, Yeah, the service user coming to hug you. Many times, my wife is a doctor, for example, and so many times, a patient will hug her, for what she's done. But on observation, she is not, going and hugging that patient, but she will let them, come and hug her as opposed to, the other way around. Okay. So it could be simple human errors, tiredness, stress, manipulation by the service users, bad luck, or a bad day at work, that wants you to have that human connection. So professional boundaries concern what is acceptable and unacceptable for a professional both at work and outside work. Service users are often, by the way, are often unaware of what the legitimate role of a health and social care practitioner is. Because in the service user or patient's mind, they think, okay, it's okay. You are there to help them feel better, and so they will want that human closeness or bond that they are used to outside of work. Huh?